Hi, my name is Olga. I'm going to be performing the skills video of drawing up insulin. I want to start off this video verifying the physician's order and going over the 6 rights of medication: right patient, right drug, right dose, right route, right time, and right documentation. Next, I want to go over the supplies. We have the NPH and the regular insulin. We have syringe and needle of 29 to 30 gauge, 1 milliliter. Gauge, basically 2 alcohol wipes, and we have a pair of gloves, gauze, and then a bandage if needed. And next I will go ahead and going to gather my supplies here, and I will knock, enter, and close the door behind me to avoid any HIPAA violations. I want to make sure that there's no family members in the room, and there isn't. I'm going to set my supplies here on a clean, dry surface. I will be giving my patient medication regular, which was 4 units, and 8 units of intermediate NPH, equalizing 12 units of insulin. I will go ahead, hand hygiene here. I will introduce myself to my patient. Hi, Mrs. Smith. My name is Olga. Can you please verify your first name and your date of birth? As she verifies that, I'm going to go ahead and verify her wristband. This is going to be my 2 patient identifications. As we started off, I'm going to verify against Samara the second time, as I did in the beginning. So, Mrs. Smith, you're going to get insulin. Your doctor has prescribed you insulin. There's going to be 2 medication vials, and that you're going to be receiving into 1 injection. You're going to be receiving insulin, basically regular insulin and intermediate insulin. I will go over the mechanisms of them, side effects and adverse reactions. The first one is regular insulin. That is a short-acting insulin. It covers 30 to 60 minutes before lunchtime. And the mechanism of that it draws out sugar levels from the blood to your into the cell and lowers blood sugar levels. Some of the side effects would be a hunger, shakiness, and anxiety. Adverse reactions, we do not want them to occur. Adverse reactions would be tingling of the lip, tachycardia, or seizures. And then the second insulin that you're going to be receiving is NPH. Same mechanism with that one, but it does cover longer than the regular. It covers half the day. Same mechanism. Side effects would be weight gain, water retention, and swellingness. And then the adverse reactions would be generalized weakness, headache, and confusion. Please let us know if any of those occur, and we will notify your physician. Do you have any questions for me? No questions. All right, 3rd time of verifying against Samar. So I'm going to have a nurse here by me, and we're going to get started. She's going to be confirming the amounts individually and the amount together, equalizing 12 units of insulin. I'm going to go ahead and hand hygiene here, and I will also want to let my patient know upon the injection you might feel a little bit of stinginess and burniness. That is normal, unfortunately. And I will go ahead and I will grab her glucose levels, and I will determine the next meal is. Hand hygiene here, and I will put my gloves on, and we're going to get started. I want to go ahead and roll my medication vials, roll it, and I will go ahead and clean the tops of the medication vials. the scar of that. I'm going to start off with my NPH. I'm going to get the air, and I will inject the air and not drop any solution. And then I'm gonna go ahead and inject the air of the regular, and I will draw up the 4 units, and then I will go ahead and draw the rest of the NPH. And that will equalize 12 units of insulin, and then the nurse and I will confirm individually to make sure that it is good against the MAR. So first I will go ahead and we're going to inject of 8 units of NPH of the air. Eight units of air. Nurse and I verify 8 units of air. Next, I'm going to inject that NPH air, not drawing up any solution. After that, we're going to get the 4 units of air of the regular. Nurse and I verify against the MAR, 4 units of air. And then I will go ahead, now I'm able to draw up the solution. We're going to inject that air back in there. We're going to use it as, hold it as a pencil. We're going to inject 4 units of regular insulin. I'm going to tap if there's any bubbles. Nurse and I verify against the MAR, 4 units of regular insulin. Next, we want to get the intermediate. We're going to make sure that we try not to inject any of the solution in there. I'm going to draw up 8 units of NPH. It's going to be equalizing to 12 units of insulin. Tap for any bubbles. 8 units of NPH equalizing 12 units. Nurse and I verify against the MAR. Next, we're going to use the swoop method. We're going to cap it. Nurse and I verify against the MAR, 8 units of insulin for my patient subcutaneously. Medication is ready to go, and if I was going to prepare this away from patient bedside, I will label the patient's name and the dosage amount.